Good morning, good evening, good afternoon. I'm Gilbert Wafula from Kenya. I'm delighted to be part of this call that we can be able to share our experiences from our country and specifically from our county and community. So first of all, I wish to introduce the others in our team. We have Maureen. Maybe Maureen, you can introduce yourself.
Good morning, good afternoon, good evening. My name is Maureen Opio. I lead community health services in Kisumu County, and I'll be doing the presentation with Gilbert. Thank you.
Thank you very much, Maureen. In absentia, we have Bella, who is unable to join us, and we have Kamlas Odus from UNICEF, who will be supporting us through the chat box and video. Thank you very much. So our topic is about nurturing care. We were measuring the effectiveness of the use of community health workers in getting the information and to the household level. So we wanted to know how effective the use of CHWs is to make sure that we get these interventions up to the household level and its uptake. Just for a brief, 7 sub-counties in Kenya, Kisumu County. Kisumu County is among the 7 sub-counties in Kenya. Then 7 sub-counties among 7 sub-counties within Kisumu County. These are rural sub-county. It has an estimated population of 141,000. Then we have trained a total of 396 community health volunteers, also call them workers. And we have a total of 36 community health units in the sub-county. So as we were exploring the effectiveness of nurturing care interventions, we took a step sometime like last year, between October and January 2023. And we did a study in one of the wards within the sub-county in Kisumu County. So I'll request that we go straight to the presentation. We'll start with Maureen, who will take us through the presentations. Thank you very much. Welcome, Maureen.
Thank you so much, Gilbert. I'll request Sita to scroll for us now that she has done the screen sharing. Oh, please go back so that I can start from there. Yes, the study is about exploring the effectiveness of nurturing care interventions by community health workers in improving child health outcomes in rural Kenya. A study that of Seme sub-county in Kisumu County. Authors Gilbert, Maureen, Kamlas, and Dr. Mihanda. Thank you. Next. So I'll start with the background. Nurturing care. Nurturing care refers to the provision of responsive caregiving, support, and protection to children. Nurturing care is essential in ensuring optimal childhood outcome, and if well practiced, it is an important way of achieving universal healthcare coverage. So a childhood is a critical stage of development as it lays the foundation of future health, well-being, and success in life only if an optimal environment is provided to support brain and development. Next, please. So the cognitive development is a process of growth and change in the intellectual and mental abilities among children. And in this, we are thinking about the cognitive ability to think and reason for the children. Then nutrition in the first 1,000 days is the vital and is very and is cognitive development, as this stage is characterized by rapid growth as well as development. This is the stage where most children develop, and there's a lot of growth in the children. Next. So globally, we can say that child malnutrition and poor cognitive abilities are a major concern. And in Sub-Saharan Africa, records the highest levels of malnutrition, that is 39%, and 4% in stunting, and 10% in wasting in children. So Kenya as a country, we record 24% of children who are stunted, and 4% who are wasted, 11% who are underweight. This is as per the Kenya Demographic Health Survey that was done in 2022. Next. Next, please. So when you look at the background on cognitive abilities, we are looking at where the study was done. And when you look at the low and middle income countries, almost 200 million children do not achieve optimal cognitive development due to poverty, malnutrition, and inadequate stimulation. And this is in relation to the study area of Seme in rural Kenya. Next. So we have scientific evidence that have confirmed that most critical elements of child, adolescent, and adult health, well-being, and productivity take shape during the first 1,000 days. This is where the rapid brain development also occurs. Children living in rural communities face significant health challenges that undermine their ability to flourish and thrive. And this is probably because of the adversities they face and the challenges such like poverty. Next. So when you look at the background in terms of nurturing care and service delivery, given that the reality of inadequate human resource in health, several governments all over the world have recognized the capacity and onboarded the community health workers to enable them reach the last mile. So in Kenya, we have community health workers who have been empowered with nurturing care skills in order to deliver and impact knowledge and transfer the nurturing care practices to the caregivers at the household level. When you look at Kisumu County, we have 2,112 community health workers who have been trained on nurturing care and have the knowledge and skills that they incorporate during their day-to-day household visit in the community. Next. So this is a diagrammatic flow of how the community health workers in Kisumu work. First, the community health workers normally do the household registration, and in Kisumu we are lucky that we adopted the electronic community health information system where the community health workers use the mobile phones. So they register the households in their areas of jurisdiction. Then thereafter, they are followed by household visitations that are conducted by the community health worker. And during the household visitations, some of the things they do is health education. They also do a lot of screening. And of course, health educate on nurturing care and practical skills that were impacted to them during the training. One of the services they also provide at the facility is referral. Referral from the household level to the link facility. And they also do the continuous follow-up on households that have health needs and households that have clients who are supposed to be followed up due to a specific reason referred from their link health facility. Next, please. So our problem statement: in Sub-Saharan Africa and in Kenya, the wider rural communities have been disadvantaged, and that is in accessing quality healthcare due to their location. So research shows that children born in these communities often have developmental challenges and therefore do not achieve their full potential in life. So children who do not experience nurturing care necessary to enable their capacity to flourish are either less healthy or they grow poorly. They learn less, and of course, when they learn less, then they compete for fewer grades in schools. They're more likely to have difficulties relating to others because of their confidence levels. And then they earn less as adults, that is in future after they have grown up. Next. So malnutrition is a major concern in Kenya, which is at 4% in Kenya, and as well as Kisumu, which is still 4%. So malnutrition has a direct impact in the first 2 years of life and negatively influences both the cognitive ability of a child and also the ability for the child to grow up. The healthcare worker, including the community health workers, have a major role in playing to improve the nutritional status and cognitive abilities for the well-being of children. So since the recognition of community health worker as a critical cadre in achieving the last mile reach in Kenya, there has been deliberate efforts to strengthen community health structures. That is strengthening as aligned in the policy and the strategy. That is the Kenya Community Health Policy of 2020-2030 and the strategy of 2020-2025 that recognizes the work of a community health worker and the work they do in the household. There has been no empirical evidence to show the effectiveness of this cadre in the child health outcome. That is nurturing care, given their close interaction with households and caregivers. Next. So our objectives in this study was to, the main objective was to explore the effectiveness of nurturing care interventions by community health workers in improving child health outcomes in the rural Kenya. And the specific objective one was to examine the last mile reach with nurturing care information pack. Second was to assess the level of uptake of nurturing care practices by the caregiver reached by the community health workers. Then the third one was to examine the referral linkage to effective care for nurturing care. Next. So the methodology for this in our study was a study design. We used mixed methodology where we had descriptive and diagnostic methods. For the data collection method, we had qualitative method and quantitative, where in qualitative method, we use focus group discussions that are done in the community to ascertain the knowledge and the source of nurturing care. Then in quantitative method, we use the CHIS, that is Kenya Health Information System data, to quantify the reach by the community health workers. Our study site was East Seme Ward in Seme Sub-County in Kisumu County, Kenya. Our sample size were 800 households. The sampling technique that was used was purposive and random sampling. Study duration, this was done in October 2022 up to January 2023. Next. The analytical methods that were used, the data were analyzed using Excels and pivot tables. Findings are also presented and visualized using the tables and bar graphs, as well as pie charts, as you'll see. Next. So we had approvals, consent, and confidentiality. The study was approved by the Department of Medical Services, Public Health and Sanitation in Kisumu. We got informed consent, and this was received from all the study participants. The data was collected and was treated with confidentiality, stored in secure cabinets, and only the investigators had access of the data. The findings of the study were shared with all stakeholders, including the study participants. Next. Okay, I'll stop there for my colleague to take you through the findings, the results. Thank you. Gilbert.
Thank you very much, Maureen. Now we want to move ahead, continue with the presentation. We're looking at the number of respondents that we were able to interview by age and by gender. We find that 15 to 20 years, the blue bar is showing the males, while the orange one is showing, representing the females. So from this data, we find that most of the respondents were female, especially from the category of 20 to 30 years. Then was followed by 30 to 50 years, who had a total of 192. From the data, we find that there was a lesser number of males who we were able to interview by that time. Next. Okay, this is the data that concerning the referrals that were done during the period. Yeah, we find that we were looking at the things. We looked at the delayed milestones and the nutritional deficiencies within that period. So delayed milestones, the CHWs, the CHWs are able to identify 12 cases which were referred, and also able to identify nutritional deficiencies which are composed of the kwashiorkor, marasmus, a total of 13, and they were all referred to the facilities for further services. Next. This is distribution of the children by age. We were looking at the caregivers we found and the children. From the previous the presentation, the slides, we have been told that we were targeting households with children between 0 to 3 years, and these were the age categories. Mothers who were pregnant by the time were 83. So we are able to interview also the pregnant mothers. We visited 0 to 11 months for 189. Then the largest number was between 1 year up to 3 years, 504. Next. Results. In continuation, we're looking at the knowledge in that area that we are covering. We found out that 96% of the respondents had knowledge on nurturing care, which was adequate. We were looking at the 5 components of nurturing care. If any of them was able to mention at least 2 components, we said that was enough knowledge to make us confirm that the household member, the caregiver, was having knowledge enough for nurturing care. Next. So, as previously mentioned, we have 800 households and 42 community workers were covering these households that we were able to interview. Next. Knowledge of nurturing care by age group. This, we looked at the knowledge concerning nurturing care. From the previous slide, I've talked about the knowledge that they had. We find that the category with the highest knowledge was between 20 to 30 years, the caregivers, then followed by that between 30 to 50 years, with at whom scored that 1% of those who are interviewed, with the lowest being 15 to 20 years. Next. Okay, the next one, looking at the distribution, 20 to 30 years age group had the most nurturing care knowledge at 34%. Diagrammatic presentation. Then of the 100% of the households that were visited, and we find that female caregivers were the leading with the highest level of knowledge of nurturing care at 72% of all the caregivers who found out that had knowledge, which was at 96% of those households that were visited. Next. We're looking at nurturing care uptake with 70% in terms of practices. 70% were practicing, then 30% didn't have, had not taken up the practice. So in assessment of the level of uptake, we found out that 70%, which was a total of 560 caregivers of the households that visited, had and used homemade play items. These were items were made locally, assembled within the household from the locally available materials. They were made into play items for the children. Then 92% of them used play and communication to stimulate the child and the parent and the caregiver. They were able to, at least they were able, there was a form of communication and also a play with the children that they were taking care of. Then 84% confirmed having engaged, trying to communicate with the unborn child, that is during pregnancy. 84% had taken up the practice. Next. So discussion, we are looking at examining the last man rate. 96.75% of the households reported being visited by the CHWs during that study period. We find that most of them, almost 100% of them, were able to confirm that they have been visited by a CHW in the recent past. Then 96% of those caregivers had suspected knowledge from what we have just seen previously. Then 72% of those with nurturing care knowledge reported that information was delivered to them by the CHWs during their routine household visitations, which as a ministry, as a Department of Health, we are focusing on that CHWs should visit these households and deliver the messages correctly. Next. Of the caregivers that were interviewed, 552 women, that is 70%. Then we had 216 men who were just in 8%, had knowledge on nurturing care. Then the age between 20 to 30 years was the age category with the highest level of nurturing care knowledge than other age cohorts, which was leading at 34%. You've just seen from the previous presentation, the slides. Next. In conclusion, CHWs are effective in ensuring and advancing the last mile rate, particularly with out of clinical setting interventions such as nurturing care. That is from the study, we can confirm they have done it so well from the area of our area of study. The regular household visits by CHWs ensures increased uptake of good practices that enable good health and well-being of children. So the more they visit these households, you find that the uptake of the good practices also was higher. CHWs are critical in the early identification and linkage to care and follow-up in the continuum of care. We've seen that all the children who had problems during that period were being referred to the link facilities for further management. Next. On our recommendations, we recommend that we should be able to allocate resources towards strengthening community health services, then scale up of nurturing care awareness and practice among community members to ensure children survive and thrive. This has been well proven, especially in the rural areas, whereby access to formal, like hospitals, formal medical services is low. We think that we recommend that we scale up nurturing care awareness, especially the community health volunteers, who will be our people to reach the households that are not reached by other means of other services that we offer, especially in urban centers. Rural, it can work so well. Next. There's a pictorial, CHWs demonstrating to the household. During the household visits, they go, they demonstrate how to make the play items, how to stimulate, how to play, to communicate to the children. So there are pictorials to show that during the routine home visits. Next. So this is just our final slide, that if we change the beginning of the story, we change the whole story. Next slide, please. Thank you, and that's the end of our presentation. Over to you.
Great. Thank you so much, Gilbert and Maureen. That was an excellent presentation and really important findings from your study. So we have a question in the chat box. What tools did the community health workers use to identify developmental delays?
Okay, I can respond to that. Our CHWs have been trained during nurturing care. We have the mother-child booklet, which has the developmental milestones of every child at every stage. We expect the child to be maybe, for example, at 2 months, we expect this child to be able to smile, to maybe to support self at a given stage. At a given stage, we expect this CHW this child to be able to sit upright and supported. So all this is in the MOH, in our tool, which is MOH 216, the maternal child health booklet that the CHWs use routinely during their home visits. The parents have, so as they go to the visit, the caregivers, they use the book to assess if the child is up to date as per the age or not.
Great, thank you so much. Maureen, did you have anything to add to that?
No, if you have any comments, addition.
Okay, great. So please feel free. Oh, did Maureen go off mute?
No. I think Gilbert answered it correctly, because we use the mother-child booklet to identify the developmental delays that has timed achievements per age group.
Great, thank you. I will have to leave, unfortunately, in the next few minutes, but we're going to continue the session at least until 10:45 to answer any questions that you may have. So I see another question from Anne. Anne, would you like to unmute yourself and ask directly?
Okay, thank you so much. This has been a fascinating presentation. I'm curious, when you're on the job, of course, you need to have tools ready. And I'm curious if in identifying the developmental delays, is there some kind of a short checklist on how are these referrals made? Something easy for the CHWs to use on the job. I would imagine a booklet would be kind of heavy to carry around and refer to while you're seeing your clients. Over.
Maureen, you know this one?
Yes, thank you so much, Anne, for your question. Our CHVs, apart from using the mother-child booklet, also had a checklist, sort of a short questionnaire that they used to administer at the household level. So they interacted with the caregivers at the household level to identify the delays. And a referral, for the referral, we use the MOH 100. That is a referral tool used by the community health workers in Kenya. Thank you.
Thank you so much. One last question. Are these tools publicly available on the Ministry of Health website?
Which tool specific, please? Come again. MH 100?
Annie, maybe if you can come in again, or Anne, sorry, if you want to come in again and repeat your question. I'm taking over for Sita as moderator. If somebody wants to come in and repeat the question, please.
Okay,
Anne,
I'm sorry. I'll repeat the question. Are these booklets and checklists and tools for CHWs publicly available on the Ministry of Health website or in another place? Over.
Okay, thank you very much for that question. MH 100 are referral tools that the CHBs have in hard copies that are given to individual CHBs. These are tools that they use in routine while doing referrals. We don't have them. We have just the soft copy form. We have them in the MH website. Then we also have MH 216, which is the mother-child booklet. We have them.
So to other participants and colleagues that are part of the presentation and who have joined this session, please feel free to ask questions, or you're most welcome to raise your hand if you have additional questions for Gilbert or Maureen. I'm not seeing any hands or questions. Oh, I see one from Minjun. Minjun, do you want to come in, please? Would you like to voice over your question, or would you prefer I read it?
Hi, thank you very much. Well, thank you for the wonderful presentation. And quick question over the sustainability of this nurturing care delivery by community health workers. How this community health workers funded by, and which program funded? Is it government owned budget or is it any project funded? And how do you see the sustainability of the program? Whether it can be integrated in the national health systems in Kenya? Thank you.
Thank you for the question. How the CHWs are funded. I'm not so sure whether we are talking about the specific study this specific study, we did it together with UNICEF Kisumu. That is the county government health department together with UNICEF, because they're implementing this. So the trainings for the community health workers were done by UNICEF on nurturing care packages. On sustainability for the community health workers in Kisumu, these are community health workers who are already identified and recognized by the county government of Kisumu, and Kisumu gives them a stipend on a monthly basis. So in terms of sustainability and how they work, we looked at a way where they can integrate nurturing care in their day-to-day activities at the household level. In terms of integrating this in the national health system, I think it's underway because we were the first who were in Kisumu who are testing the curriculum on nurturing care package for community health workers in Kenya. So we're the first to pilot this in Kisumu using the Ministry of Health curriculum that was being tested. So I think this is something that is underway and probably will be published with time, because it was we already had one that was developed. Thank you.
Thank you, Maureen. Just an addition to the issue of sustainability, these community health workers are organized in community health units, and within those community health units, they also have income generating activities that supports them as they go about their routine service delivery. Thank you.
Minjun, thanks for the great question. Are there other questions for Gilbert and Maureen? Gilbert and Maureen, any final thoughts? If there are no additional questions, then I think we can close, but I'd like to give the two of you the final word, and just to reiterate our thanks for the excellent presentation and from joining your evening in Kenya. It was really interesting to hear about the work that you're doing in Kisumu. So over to you for final words, and just gratitude from our side for your time and the excellent work on the presentation and study.
I'm Dr. Joey from.
Thank you very much. I want to thank
I'm from the
our team, support from the county government, national government, and also the partner UNICEF, and all my co-authors for the work they have done. Those data collectors, I want to thank all of them. And my great thanks goes back to the CHWs who are doing a good work at the community level. My request is just that we support the community health workers at all levels so that we are able to reach that underprivileged population. Then we offer services so that they also get equal service equity in terms of health service delivery, so that better their health indicators. Thank you very much. Once again, over to Maureen.
Thank you so much. I think Gilbert has summed it all. I just want to give thanks to also the Child Health Task Force for giving us an opportunity to share what we're doing in Kisumu. In whatever way, small way, we are impacting the lives of the communities and the children in Kisumu County, and we wanted to share with the rest of the communities to see what you're doing. So thank you so much for the opportunity presented.
Thank you, Gilbert. Thank you, Maureen. Keep up the great work in Kisumu. It's so nice to hear about what you're doing, and thank you for recognizing the community health workers as well. Indeed important that what they're doing on the front lines. Thank you so much, everyone. With that, we can close. And just a reminder, the recording will be available on the Child Health Task Force website. Thank you all. Gilbert, Maureen, thank you. Good evening.
Thank you very much, Bye.
Good evening.